Hello, everyone. Welcome to My Weight Live. Tonight, we're talking with weight management expert, Dr. Judy Shiau, and she's going to be separating weight loss facts from fiction. It's going to be a great show, but before we get started, tell me where you're watching from tonight, folks, and what's on your mind. I'm so glad you've joined us. Dr. Shiau, thank you so much for being here with us tonight.
Thank you so much for inviting me.
So I want to start right off with the most common myth we hear about losing weight. And that's if we just eat less and exercise more, we'll be able to lose weight and keep it off.
Yeah.
Tell us why that is a myth.
It's a myth because just saying that it's all about diet and exercise isn't the complete truth, because there are over, say, 300 factors that impact our weight. And diet and exercise are just two of those. And so the realities are there's a lot of factors that we don't control. Our genetics, the environment. Nobody controls COVID. Who knew that was going to happen, right? The socioeconomic status that a person is living in, we don't necessarily have control over. And then there are only some things that we can control, and that's our behaviors. And diet and exercise is part of that, but definitely there's a bigger spectrum at play.
All right, so we're going to talk all about the different factors and the ones that we can do something about. But before we get into that, I want to do tonight's trivia question. Folks, if you answer tonight's question, you will get our free indoor workouts guide. I don't know about you, but I don't feel very motivated to walk outside when it's cold and rainy, so this guide is perfect as winter is upon us. Definitely something you want to download and check out, and you will get it for free if you answer tonight's trivia question, which is, true or false, going on a gluten-free diet will eliminate carbohydrates from your diet? Is that true or false? Will going gluten-free mean that you don't eat carbs anymore? Put your answer in the comments and you will get that awesome guide to indoor workouts. Dr. Shiau, you're one of the authors of the Canadian Adult Obesity Clinical Practice Guidelines that were released back in August. And so I'd like to talk with you about a few more common beliefs about weight that, according to the guidelines, are just untrue. You ready?
I'm ready.
All right. So one really big myth about people living with obesity is that they're lazy or unmotivated or they lack willpower. And the guidelines make it clear that this is actually weight bias. And there's a lot of evidence that stigma and weight bias can actually lead to weight gain and worse health. So talk about weight bias and what people living with obesity should know about it.
I think that's one of the most unique chapters in the guidelines, of which there are 19 chapters. For weight bias, there's actually 3 different types of weight bias. There's explicit weight bias, which is the fat shaming that you can hear people talk about or say, or that you might see on television or commercials, etc. There's implicit weight bias, for instance, not having chairs that are big enough for people living with obesity. And then there's internal weight bias. And what that means is actually how a person who's living with obesity might view themselves. And in fact, I could say that sometimes the worst fat shamers that I know are actually people who are living with obesity. They are so hard on themselves. They feel like they deserve where they happen to be at. And it's just absolutely not true. And one of the big messages that we're coming out with these guidelines is that obesity is a chronic disease. And it's not their fault that they're at the stage where they're at.
All right, so this is a great moment to talk about what you call the 4 C's, kind of the 4 tools that people have who are dealing with obesity or excess weight. So tell us, what are the 4 C's and why are they so important?
The first C would be compassion. And that addresses that internal weight bias, having self-compassion for yourself and understanding, again, that it's not your fault. And instead of hitting yourself with a stick and beating yourself up all the time for things not going quite the way you were hoping to, and asking yourself, what's the matter with me? You now go to the question of what matters to me, okay? And you're looking at, why am I doing all this hard work? You know, often enough people say, I want to lose weight to become healthy. The question they should then ask themselves is, what am I going to do with those extra years of health? Is it maybe I can travel? Is it so that I can play with my grandchildren? And from that, you learn about your values. And that's what drives you to then go to the second C, which is change. What is the behavioral change that I can now do to help me move in the direction that I want to go? And when I say behavioral change, I'm trying to focus on, what is it during my day that I can do realistically that ultimately might help me with respect to weight management? Is it having a breakfast? Is it going for a walk? You just talked about the activity guide. Maybe it will be following through on the activity guide and actually opening the link, right? The third C is to commit. Commit to that action. Try it out. And maybe after who knows how much time span and it's not quite working, okay. Go back to the first C, have a bit of compassion for yourself, understand that, hey, you know what? Maybe it didn't quite work out. Let me try another change. And then the last C is actually to connect. Connect with somebody to do this with you. Studies show that, us human beings, we like to have socialization. And in fact, COVID has been a really tough time with social isolation and loneliness. And if you can find someone there to be your partner, a relative, a neighbor, excellent. Another potential person that you could connect with is your healthcare provider. That healthcare provider, especially armed with these new guidelines, may be a great resource for you to head towards all those 4 C's.
Gosh, I love the 4 C's. I think that's so impactful. And I love that your first C is compassion, because as you say, that internalized weight bias that many people feel, because I haven't been able to be successful with my weight, I'm X, Y, and Z. I think starting with that is just so important. Folks, as you're hearing Dr. Shiau talk about the guidelines, if you'd like to learn more about them, we're going to link to several great resources in the comments. And if you're looking for that 4th C, that connection, we have a wonderful Facebook group that you can join for free that has a lot of really wonderful people in it who are all moving towards better health and committing to change. Dr. Shiau, if you could give us an example of how a change that you might recommend someone make and commit to. I think sometimes getting really granular is helpful. So what's a change that someone might realize matters to them and think about going ahead and committing to?
So the best answer for that is actually what a person as the individual would view as the most realistic change. So actually very key to the guidelines is to make sure that us as healthcare practitioners, we're not there to tell you what to do, okay? Because us telling you what to do doesn't ultimately lead towards maybe a change that you want to do. And so it's really you yourself who knows your 24-hour day. You know what your sleep habits are like. You know what your nutrition is like. You know what your activity is like. You know what the stress is like. You know what your socioeconomic status is like. You know what you have access to and what you don't have access to. And maybe me as a clinician, I might say, hey, you know what? Having breakfast is the most important part of the day. And you might say, screw that. I never eat breakfast. I would rather open up this guidebook for activity and start practicing that. And that is the change you go with. You go with the change that is most realistic for yourself. Now, here's the other trick. Don't go about trying to go for that change and saying, I'm going to go, I'm going to go for a 30-minute jog every day, 7 days a week, rain or shine. And if I ask you, are you 90% confident that you'll do that? And your answer to me is, I would say this is not the change for you. What would make you 90% confident? Well, if I did it twice a week, let's go for that. That is the behavioral change. You're going for your 90% confident behavioral change that you feel is realistic. Why? Because once you hit that goal and you feel more happy, you feel more confident, right? If you didn't hit that goal, what's going to happen? You kind of give up.
So pick something we know we can achieve and pick something we're confident we'll actually be able to do and focus it back to what matters to us. Again, why am I doing this?
Yes.
Wow. All right. So for those of you who have just joined us, we're here with Dr. Judy Shiau talking about weight loss facts versus fiction. And if you missed it earlier, we are giving away a free guide to indoor workouts to anyone who answers our trivia question tonight. So if you missed it, that question again, true or false, going on a gluten-free diet will eliminate carbs from your diet. Is that true or false? Put your answer in the comments to get that free guide to indoor workouts. All right, we know that healthy habits are important for managing obesity or excess weight, just as they are for any chronic disease. A common question we get often is whether when we eat makes a difference. Is it true that eating too close to bedtime can make us gain weight? Is there a time at night when we should try and stop eating?
That's a very interesting question. And actually, even in people in the normal weight category, there's some evidence that our body just doesn't handle food as well in the evenings. We're more insulin resistant. So it does make sense to try to limit at a certain time, avoiding having late foods. What is that magical time? I don't think we have the best of evidence for that. And it really, again, boils down to the individual. So perhaps it makes sense for some to say, I won't have anything after 8 o'clock. But let's say you're a shift worker. Maybe that doesn't make sense anymore, right? So again, it boils down to an individual's 24-hour day. I think the best strategy in the end for a person who's trying to manage weight, sure, some people are going to manage it on their own, but if you have a team with you, and a team would consist of your healthcare provider, it'd be terrific if there was a dietitian involved. It'd be great if there is a counselor involved. On our site, we make sure that every one of us are trained in behavioral changes, specifically ACT therapy, which is a form of CBT. And that in itself can be very helpful because a lot of people, again, know what to do, but don't necessarily do it. And you're not alone. This is very normal. It's very normal to actually struggle through this. And that's why you need help.
And compassion for yourself, recognizing
Exactly.
I'm not alone and
Back
knowing
to
what
4 C's.
Exactly. And going to seek help, knowing that there are resources out there. Folks, Dr. Shiau is sharing such great information with us here tonight. If you're inspired to learn more from other medical experts while you're in the car or on a walk, check out our podcast. We have in-depth interviews with physicians, dietitians, and psychologists on a wide variety of topics related to reaching your best weight. Just search My Weight What to Know wherever you listen to podcasts, and we'll put a link in the comments too. Dr. Shiau, the guidelines emphasize that there are several medical treatments for obesity, often referred to as the 3 pillars: behavioral interventions, prescription medications, and bariatric surgery. And I'd like to talk with you about each of them. So, behavioral interventions. You talked a little bit about CBT and ACT. What is kind of the category of behavioral interventions, and why are they so important?
Behavioral interventions are so important because it's essentially the crux of everything we do or want to do. In fact, going through the process of surgery, taking medications in itself is a behavior, right? That's a choice that I make.
You're right.
And so the key, though, is we often deviate from the direction that we're hoping to go, right? And that's why it's so important to have an understanding of what your values are and what will keep on motivating you to choose those behaviors that would be most helpful to you. So it's not uncommon that you start off your day. You have everything in place. You have your breakfast. You go for your walk. You have a lunch that you pre-packed. You come home and it all goes to pit, right? Because you're tired. You don't have any more mental energy to figure out what to do for the day, and you do takeout. And that behavior obviously doesn't work with where you're going. That's where you have to have that compassion and say to yourself, hey, you know what? I was tired. My executive brain just couldn't make that decision at a time. My battery's drained. How can I recharge? Maybe I should have taken a bath, right? A warm, relaxing bath. Maybe I can go for that walk at that time because that will be refreshing. So behavioral changes is learning how to continue to move in the direction that you want to go. And that can include taking medications. So what are the medications that exist? There are 3 in Canada right now.
Let's jump right to that second pillar. Yes, medications.
Oh, yeah, and so medications. There are 3 medications in Canada, and I'll list them for you. There's Xenical, there's Contrave, and there's Saxenda. And all of them have, on average, let's say, depending on the person, a 3 to 5% weight loss. So at times, you will see people who lose a lot more, and then you'll see some people who don't lose as much.
I guess one question for you about medications or surgery. Let's say that someone goes to their doctor and their doctor says, you don't need medications or surgery. You just need to eat less and move more. Mm-hmm. What would you encourage that person to say to their doctors, and how might they be able to use the guidelines to kind of change that conversation?
I think it's part of an education and dialogue. And your doctor or your healthcare provider isn't trying to be super mean. They're just not realizing how hard you're working. You are working super hard at managing your weight, and people don't appreciate that. It isn't about eat less, move more. It's about what other changes that we can do to support all the hard work that you do. And that's the behavioral changes. It could be medications. It could be surgery. And I would say if you have a healthcare provider who does make that comment to you, you can mention, by the way, there's a Canadian obesity guidelines that just came out. Perhaps you'd be interested in reading a few chapters. And this is just, again, trying to have that conversation.
I think that's really a really great response, because it's kind of like, now this isn't, what I'm saying. This is what a lot of experts in Canada are saying about, obesity and what it takes to manage it. So a treatment for obesity that has been proven to be really the most effective when it comes to actual weight loss is surgery. What should people watching know about bariatric surgery, and how might they decide whether that's something they want to explore?
Bariatric surgery, and there's different types, work in a fashion where you have a smaller stomach. And then also for some of the types of surgery, you also have a malabsorptive component. So you're not even absorbing what small amount you do eat. Hence, that can also be a great aspect for lower calories and therefore weight loss. So typically I can quote anywhere between 20 to 35% weight loss with bariatric surgery. Now, the thing is, it's not like the magic wand. I'm not going to have surgery and expect everything to be fixed. You still have to work on those behaviors. Okay. And if anything, you still have to work at it hard. You have to make sure you've got good nutrition, separate your liquids from your solids, make sure you take your vitamins. This is absolute. I can't tell you how many people I know after surgery who have stopped taking their vitamins. And it's not because they meant to, it's because they forgot. And this is a behavior that must continue in order to prevent bad things from happening. And I actually emphasize that. I happen to be a writer for the post-operative surgical chapter. And a lot of bad things can be avoided if you take your vitamins. The other thing to recognize with bariatric surgery too is that, there is some weight regain after surgery. Okay? There is a weight regain with any type of treatment option, whether it's medications, behavioral change strategies, or surgery. And again, it's not your fault. Remember that. Okay? There's a normalcy in weight regain. But if it's significant, then this is, again, a time to reflect, work with your healthcare provider, connect, and try to sort out what is it that might be the change that you would do to help mitigate that weight regain.
So when we talked with patient advocate Ian Patton, he said for him, the real big learning from the guidelines was that, his vision was, I do surgery and nothing else, or I take medications and nothing else. And that he really realized from the guidelines that these are tools that can be used in conjunction with each other.
That's right. So think of this as the parallel. So again, we view obesity as a disease. Let's think of the parallel of heart disease. So if I have some angina, so I have some blockages in my heart and I go on some medications, but my angina progresses, what do? I might wind up eventually having a stent, or I go on to bypass. But I don't necessarily stop on my medications. I still stay on my aspirin. I might I'll still stay on a cholesterol pill. I might be on another blood thinner at this point. And I have to continue this. And I have to continue to see my cardiologist, right?
Right.
This is the same as weight. We're not going to give up seeing our specialist or seeing our primary care practitioner just because we kind of hit a number that we're happy at. And by the way, with the guidelines, we're trying to get away from that number and looking at other relevant types of success markers. Maybe I have less pain in my knees. Maybe I'm now more mobile, whatever it is. But bottom line is, absolutely it makes sense layering these different types of therapies.
All right. So you already mentioned it. It was our last myth for tonight. Kind of once we've lost the weight, we've gotten to whether the health goals that we wanted or a number that we wanted, that we don't need treatment anymore. Why is this not true? Why is kind of our journey to reach a healthier weight and maintain good health? Why do people need to continue to work with their doctor to maintain that good health over time?
Yes, exactly. And so the parallel again being with coronary artery disease, right? No one would blink an eye about not having continued treatment if you've had a heart attack. So no one, or cancer therapy. Like I have cancer and I'm treated. I still want to be monitored if I have a reoccurrence. And the same thing applies to obesity.
I love it. Dr. Shiau, as you said, you're one of the key authors on the Canadian practice guidelines. What do you feel makes them such a big deal for people living with obesity? Why are they so important? What should people living with obesity know about them?
Number one would be that obesity is a chronic disease, and hence, this is not your fault. Number two is that there is treatment out there, and please access it. Number three, to understand that you're not alone. A lot of people feel alone, particularly in these times. And when they're in a group or when they see others that are working their way through this, I think then they appreciate that their struggles aren't just themselves. It's a lot of people who are having the same issues with respect to weight. I think also that these guidelines are a great platform for being able to go to your politicians, right? And going to your government and saying, hey, look, you know what? There are these treatment options, but they're expensive. Is there ways of funding for this? Another aspect of the obesity guidelines that I think is really important is that we're trying to get away from the number. So for patients or people living with obesity, where, there's a certain number in your mind that you're thinking that you want to get to, well, let's think again of other measures of success. And the other measures of success, again, could be I feel more energy. My cholesterol levels are better. My sugar levels are better. I'm no longer pre-diabetes. And so with that in mind is not making it all about the number.
I'm really glad you emphasized that because I think that's one of my favorite things about the guidelines, kind of moving our attention away from the thing we don't really have a lot of control over, which is that number on the scale, and moving it towards the healthy behaviors that we want to focus on, that change and commit part of your 4Cs. So I think that's really important. Dr. Shiau, thank you so much for joining us tonight. I really appreciate you taking the time to really explain a lot of these common misconceptions for us and debunk them. So thank you.
Thank you for inviting me.
Before I say goodbye to all of you at home, I want to make sure I give you the answer to tonight's trivia question. True or false, going on a gluten-free diet will eliminate carbs from your diet? The answer is false. If you haven't answered that trivia question yet, leave a comment for us and tell us what you thought of tonight's show, and you will get that indoor workout guide. We are also going to put a link in the comments to Dr. Shiau's wonderful clinic in Ottawa. Be sure to check it out. And I just want to say thank you so much for tuning in tonight. I hope the conversation was helpful for you. And be sure to join us next time, Tuesday, December 7th at 8:30 p.m. Eastern Time. Until then, stay safe, stay healthy, and take good care. Good night.